Hi, my name is Dr. Ross Hauser. Thank you for watching this video. We're going to talk about something that's called Thunderclap Headaches. So we definitely have patients, and I'm sure there's some people that are watching this that at one point in their life has had a headache that has been the worst headache they've ever had, and it comes on like very, very quickly. And it might keep recurring and nobody can figure out the cause. So that's kind of what I want to talk about, like the worst headache you ever had. When it first happens, like let's just say I woke up one day and it was the worst headache I ever had, and it's like horrible, I've never had anything like this, I would absolutely go to the hospital. I'm just telling you, I would go to the hospital because you might have had a spontaneous rupture of one of the blood vessels in your brain, whether it's a vein, whether it's an artery. Subarachnoid hemorrhage has a 50% mortality when it first happens. It means that an artery is burst. The only thing that's keeping the person alive is a little blood clot that the person has right there. And if, you know, it's a medical emergency, you absolutely could die. So when somebody has like a thunderclap headache, it just means the worst headache they've ever had in their life, you know, all over their head, you know, you have to go to the hospital and you have to get a, you know, CT scan or brain MRI, and you have to see, you know, is there blood, you know, is there blood in the brain, and then is it venous blood or arterial blood? So definitely do that. So in other words, in headaches where it's the worst headache you ever had, about 50% of the time they can't find the cause. So I know that within a half an hour of me making this video, I know I have a patient coming in who the symptom is not this, but they get where out of their eye they can't see. Like in other words, they get intermittent where they literally cannot see out of the one eye. So the person's spouse is a healthcare provider, and I was explaining to them that that's because of vasoconstriction of the ophthalmic artery probably, and the ophthalmic artery is the last branch of the internal carotid artery before it goes into the brain. So the question is, why would an artery all of a sudden constrict, right? Because that's basically subarachnoid hemorrhage. One of the things it causes is it causes spasms of the arteries in the brain. Like it's a well-known cause. Like you can see it on a arteriogram or whatever. It's like the arteries keep opening and closing, and the problem with that is it's cutting off blood supply to the brain, and what kills a person once they make it to the hospital, if they end up dying, is the vasospasm. That's what it's called, vasospasm of the arteries of the brain. And when I was an intern at Hines VA Medical Center in Chicago, I did 1 month in neurosurgery. So gentleman came in, I was the intern on the neurosurgery ward. You know, I was the intern. I had some great neurosurgeons that were above me. One of them is Tom Arigitano, who is just a brilliant neurosurgeon. He's been the head of like neurosurgery at Loyola. Now he's in Montana. So if he ends up watching this, just have the utmost respect for Dr. Arigitano. So in other words, the person all of a sudden fainted, came to the hospital, had a subarachnoid hemorrhage, and then I was in the operation when they clipped the artery that had burst, like the aneurysm in the person's brain had burst, so we clipped it, and I was in that operation, so I saw the whole operation. Then I followed the person as the intern during their hospitalization. So after the successful operation, the goal is to reduce the vasospasm because there's still all that blood in there. And then unfortunately for this person, they couldn't stop the vasospasm. So what happened is eventually a fourth of the brain died, then a half of the brain died, and then basically the person's brain was dead. And I had to go with the resident to the family. So I was there too when we had to tell the family that their dad, their husband, was alive because of the ventilator, but they were brain dead. So they no longer existed. So then you have to pull the plug because their brain's dead. So I got to see that. I got to see the seriousness of vasospasm that relates to the brain. So even the person that's coming in 45 minutes, it may seem like, oh, I just, I got an ocular migraine, right? I got an ocular migraine, or I've seen patient with hemiplegic migraine where right in front of me, I had only known the person for 3 minutes and they had an episode right there when I was just initially taking the history. They said, "Doctor, I'm having an episode." So basically, and Izzy was there too because I had her film some of it. Then basically right in front of us, the person went from talking normally to I mean, literally the blood supply to one part of their brain completely stopped for whatever, 3, 4, 5 minutes, and they had complete, like almost like they had a stroke. So these are really, really serious things, because if you decrease the blood supply to any part of the brain, you have the risk of having a stroke or permanent brain damage. So the question is, what causes this? Well, there were some innovative researchers in of all places, Iran. They're brilliant, Tehran University in Iran, that they induced this kind of subarachnoid hemorrhage in animals, specifically rabbits. And then what they did was they sacrificed the rabbits and they looked at their vagus nerve, and what they found was the survival of the rabbits, as far as because some rabbits died just from the vasospasm and other rabbits survived. It totally correlated with how degenerated their vagus nerves are. So now we have one of the mechanisms by which you get vasospasm in the arteries of the brain is from vagus nerve degeneration. So somebody who has some kind of weird neurologic thing that the doctors say is a migraine, or they don't really quite know, but it's something related to the arteries of the brain. It can occur just because the vagus nerve can't inhibit the sympathetic system. It can't inhibit the sympathetic system from causing vasoconstriction of the arteries in the head. So sometimes this condition goes by different names: thunderclap headache or intermittent cerebral vasoconstriction syndrome. But anything that is from an artery that's intermittently collapsing from vasospasm, and this can occur in the heart too, right? There's people who have angina and the doctors don't know why. Like, in other words, there's not plaque, so they get intermittent vasospasm of the arteries of the heart, so they get temporary ischemia. You have to think of it may be caused by inhibition of the vagus inputs because of cervical instability or cervical destructure. So if somebody has a condition, intermittent cerebral ischemia, intermittent heart ischemia, even the kidney, like in the rabbit studies that I talked about where the vagus nerve degeneration correlated with the survival and vasospasm, like in the brain, they also showed that when you had vagus nerve degeneration, it also caused vasospasm in the arteries to the lungs, arteries to the kidneys, even the blood supply to the lymph nodes, because they had lymph node degeneration. So if you have a medical condition where it just seems like the blood supply to something is getting cut off, definitely look into cervical instability, cervical destruction. If it's found, it's treatable, and the treatment is do curve correction, do prolotherapy to tighten the ligaments, and then normally the vascular studies, and we do dynamic studies, get back to normal, and with it, of course, the life gets back to normal.